Bilirubin, the pigment we associate with jaundice, is often portrayed as just a waste product of heme metabolism. But current research is starting to pinpoint a positive role of bilirubin when it's produced at optimal levels. It turns out that bilirubin is a potent antioxidant and anti-inflammatory with protective roles against cardiovascular disease, metabolic syndrome, and type 2 diabetes. It is only at very high levels, indicative of liver dysfunction, that it accumulates in the skin and becomes toxic. The majority of bilirubin is produced in the spleen, where senescent red blood cells die and get recycled. Heme, the red pigment of hemoglobin, is converted to green biliverdin and then to yellow bilirubin. Bilirubin is then transported to the liver, where it is conjugated to glucuronic acid in the process called glucuronidation. The conjugated form of bilirubin is excreted with the bile. Serum bilirubin levels fluctuate during the day and also with the season. It is higher in the morning and during the summer. Women have lower levels of bilirubin than men, and women are also 4 times more likely to develop seasonal depression. A study done in 2002 found that patients with seasonal depression had lower bilirubin levels compared to healthy controls. According to this preliminary report, 1 hour of morning full-spectrum light therapy was able to raise the levels of bilirubin and reduce depression scores in patients enrolled in the study. Another study from 2018 confirmed this result and narrowed the antidepressive effects of light therapy to the blue spectrum, the type of light capable of inducing the expression of heme oxygenase, the enzyme that starts the breakdown of heme. Indeed, decreased expression of heme oxygenase, or HO1 for short, is associated with depressive symptoms. A 2016 study found inducible HO1 was specifically decreased in patients with depression and was significantly associated with both the prevalence and severity of depressive symptoms. In times of ancient Greece, people prone to sadness or depression were known as having a melancholic temperament. The organ associated with melancholy was, not surprisingly, the spleen, and the corresponding humor was the so-called black bile. A modern correlate of black bile was never found, but is it possible that melancholy was due to low bilirubin? If the precursors of bilirubin were accumulating in the spleens of melancholic patients, a combination of these pigments, red heme and green biliverdin, together could indeed yield a blackish color. Another feature of people with melancholic temperament was their propensity to developing cancer. This has been described by Dr. Jason Fung in his book, The Cancer Code. And modern studies also show that depression increases the risk of cancer. One such study found that patients with depression have an increased risk of cancer, ranging from 10% to 39% depending on the type of cancer. Cancer risk was highest in patients with depression for lung, GI, breast, and urinary cancer. Not only depression, but also serum levels of bilirubin are related to cancer risk. Researchers measured bilirubin levels at the onset of the study and then followed the subjects for about 4.7 years. They noted that baseline bilirubin levels were negatively and non-linearly associated with the risk of lung, men, colon, and cervical cancer. In contrast, a U-shaped association was observed for breast and prostate cancer. It seems important to keep bilirubin levels in the optimal range, not so high that it becomes toxic, but also not so low that it allows depression and cancer to set in. Several factors that can boost bilirubin are fasting, aerobic exercise, morning exposure to sunlight, and high altitude. Also, greater consumption of flavonoid-rich fruit and vegetables is positively associated with bilirubin levels. And lastly, a green tea constituent EGCG can enhance cellular levels of bilirubin by boosting heme oxygenase, just like morning sunshine.